We're tracking new developments now in the Ebola outbreak.
We've learned a man who grew up in Providence is now receiving an experimental drug to help him combat the Ebola virus.
Ashoka Mukpo is being given the same drug used to treat an Ebola patient in Dallas. The nurse in charge of his unit tells us he's stable but not feeling well.
There's also growing concerns about the spread of Ebola outside of West Africa. A nursing assistant contracted the disease while treating a patient in Spain. Now, co-workers are concerned for their own safety. And
Connecticut's governor today declared a public health emergency to help prepare his state for the potential threat of Ebola.
We have in-depth coverage for you, beginning with Eyewitness News reporter Susan Campbell, who has the latest on the former Rhode Islander battling the disease.
Today, Ashoka Mukpo's medical team stressed the treatment for every Ebola patient is different. His doctors say giving him an experimental drug is his best option. Inside the biocontainment unit at the Nebraska Medical Center, Ashoka Mukpo is fighting for his health.
He's doing okay. I would say that he's stable, but experiencing quite a bit of nausea, some vomiting. So we're just treating him supportively to kind of manage those symptoms.
Shelly Schweedhelm is a nurse who's overseeing the biocontainment unit. We spoke with her this afternoon over FaceTime. Have you noticed a difference over the past 24 hours in his condition?
I think the condition change would be that he's more nauseated and having some vomiting at this time, when he really wasn't having that yesterday.
Is Ashoka able to be up and walking around, or is he confined to his hospital bed right now?
He's getting up and about and doing what he needs to do from his daily cares perspectives.
We also learned Mukpo is taking an experimental antiviral drug called Brincidofovir, the same drug that was given to the Ebola patient in Dallas. Mukpo's medical team consulted with the CDC and the FDA, and doctors say they believe the drug is Mukpo's best option for treatment.
It's very limited in its use with Ebola patients thus far, so it's just very hard to surmise about what that might look like from a course of treatment.
Mukpo was freelancing for NBC News when he was diagnosed with Ebola. The 33-year-old told his parents he believes he may have been infected when he was cleaning a car where someone had died of the disease. As we've reported, Ashoka Mukpo is the second Ebola patient to be treated at the Nebraska Medical Center. Coming up new at 6, how treating Dr. Rick Sacra has helped the same team also treat Mukpo. I'm Susan Campbell, Eyewitness News.
Now we turn to the Ebola outbreak. We have new information on the latest American diagnosed with the virus who grew up in Rhode Island. Ashoka Mukpo is now receiving an experimental drug at the Nebraska Medical Center. New at 6, we're taking a closer look at how treating a Massachusetts doctor with the virus is helping the same medical team take care of Mukpo. Eyewitness News reporter Susan Campbell is live in the newsroom now with more.
Shannon and I spoke with one of the members of Mukpo's medical team over FaceTime this afternoon. She stressed treatment for every Ebola patient is different, but she says the team did learn a lot while treating Dr. Rick Sacra. After Ashoka Mukpo landed in Nebraska, he was rushed to the Nebraska Medical Center. Now we know the 33-year-old Rhode Islander is being treated for Ebola with an experimental antiviral drug.
He's doing okay. I would say that he's stable, but experiencing quite a bit of nausea, some vomiting.
Shelly Schweedhelm is a nurse overseeing the hospital's biocontainment unit, and she's part of the same team that treated Dr. Rick Sacra. He was cured of Ebola last month.
So they each came to us at different points in their illness, and so I think that plays a part. I think any treatment they received before they got to us plays a part. I think the experimental drugs play a part, so it's really very, very hard to compare.
Is this time around a little bit easier for the staff? Do you feel a little more confident?
I'm not sure the word confidence is right. I think it just seems more consistent and matter of fact, and there were things to be tweaked and processes to be fine-tuned, and really this time we felt like we had those pretty solid.
Mukpo was freelancing for NBC News in Liberia when he was diagnosed with the disease. I also asked if Mukpo has enough strength to get up and walk around his hospital room. The answer was yes. Live in the newsroom, Susan Campbell, Eyewitness News.